Administering iron and tooth clipping are both important practices in pig farming, especially for the welfare and health of piglets. 1. Administering iron. Piglets are born with low iron reserves, and their iron intake from sow's milk alone is insufficient to meet their needs. Iron is essential for the production of hemoglobin, the molecule in red blood cells that carries oxygen throughout the body. Without enough iron, piglets can develop anemia, which leads to poor growth, weakness, and increased susceptibility to disease. Administering supplemental iron, typically within the first few days of life, helps prevent anemia and supports healthy growth and development in piglets. Tooth clipping. Piglets are born with needle-sharp teeth, which can cause injuries to their littermates or the sow's udder while nursing. This can lead to reduced milk intake, poor growth, and even infection. Tooth clipping involves trimming the sharp points of the piglet's teeth shortly after birth to reduce the risk of injury. By preventing injuries to the udder, tooth clipping ensures that piglets can nurse effectively, receive adequate nutrition, and grow properly. It also reduces the likelihood of aggressive behavior among littermates, promoting a more harmonious nursing environment. Both practices, when done properly and at the appropriate time, contribute to the overall welfare, health, and productivity of piglets in a swine operation. They help minimize the risk of common health issues and ensure that piglets have the best start in life, setting them up for success as they grow into healthy, productive pigs. Subscribe now to Farm Wisdom and unlock access to expert advice. Learn from experienced farmers and industry professionals who. Moreover, administering iron and tooth clipping to piglets are preventive measures that can save both time and resources for pig farmers in the long run. By addressing potential health issues early on, such as anemia and nursing injuries, farmers can avoid costly treatments and interventions later in the pig's life. Additionally, ensuring the well-being of piglets from the start promotes efficient growth and development, ultimately leading to higher productivity and profitability in the swine operation. Overall, these practices are essential components of responsible pig management, supporting both the welfare of the animals and the success of the farming enterprise. Failure to administer iron to piglets can have detrimental consequences for their health and development. Piglets are born with low iron reserves, and their iron intake from sow's milk alone is insufficient to meet their needs. Without supplemental iron, piglets are at risk of developing anemia, a condition characterized by low levels of red blood cells and hemoglobin. Anemic piglets may exhibit symptoms such as weakness, lethargy, pale mucous membranes, poor growth, and increased susceptibility to infections. Severe anemia can lead to reduced feed intake, impaired immunity, and even death. Additionally, anemic piglets may suffer from reduced performance and profitability in the long term. Failure to administer iron to piglets not only compromises their welfare, but also poses challenges for pig farmers. Treating anemia and its associated complications can be costly and time-consuming. Furthermore, anemic piglets may require additional management practices to support their recovery, such as increased monitoring, nutritional supplementation, and veterinary care. Overall, the failure to administer iron to piglets can result in significant health problems and economic losses for pig farmers. It underscores the importance of implementing proper management practices, including iron supplementation, to ensure the health and well-being of piglets and swine operations. Anemia can have significant impacts on piglets' health and well-being. 1. Reduced growth. Anemic piglets often experience poor growth rates compared to healthy littermates. This can lead to delays in reaching target weights and sizes, impacting their overall productivity and profitability. 2. Weakness and lethargy. Anemia can cause piglets to feel weak and lethargic, affecting their ability to nurse, move around, and interact with their environment. This weakness can further exacerbate growth problems and make piglets more susceptible to environmental stressors and diseases. 3. Increased susceptibility to infections. Anemic piglets have compromised immune systems, making them more susceptible to infections. They may be unable to fight off common pathogens, leading to a higher incidence of diseases such as respiratory infections, diarrhea, and other health issues. 4. Reduced performance. Anemic piglets often exhibit reduced performance in terms of feed efficiency, nutrient utilization, and overall health. This can translate to lower productivity and profitability for pig farmers, as anemic piglets may require additional resources and interventions to support their growth and development. Mortality. In severe cases, untreated anemia can lead to increased mortality among piglets. Without adequate levels of hemoglobin to transport oxygen to vital organs and tissues, piglets may succumb to the effects of oxygen deprivation and organ failure. Overall, anemia can have profound negative impacts on piglet health, growth, and performance. It underscores the importance of implementing proper management practices, including iron supplementation and monitoring, to prevent and address anemia in pig farming operations.